We're talking about your cat and first aid in your cat. One of the common things that we see in cats is a thing called an upper respiratory virus. Upper respiratory virus can be very serious, but usually is not. It's kind of like a common cold for us, but there's certain things that you can do before you get your cat to a veterinarian. First of all, it's very important to try and prevent your cat from getting an upper respiratory virus. There are vaccines that are available from your cat. Cats should start a vaccination program between 6 and 8 weeks of age, and you should consult your veterinarian at that time to be sure adequate boosters are done in this early phase of the cat's life. These cats at this age don't have a very good immunity, and why these vaccinations are very important. Sometimes these upper respiratory viruses can look very much like an emergency situation because your cat has so much discharge coming from their eyes and their nose that they're having a hard time breathing. Their eyes look all bloodshot. They really look miserable. Once again, it's not something that usually requires emergency care with your veterinarian, but there are a few things that you can do at home to make your cat more comfortable. Oftentimes your veterinarian will want to put your cat on some antibiotics during this time period. Be sure that your cat is eating and drinking well. That's the real key, as when you're going to need to have your veterinarian intervene. If your cat becomes so miserable with an upper respiratory virus that they can't smell their own food and they stop eating and drinking, obviously they're going to get dehydrated and start doing poorly, and they can't fight the virus off themselves. So once again, upper respiratory virus usually manifests itself by a lot of discharge from their nose, some discharge from their eyes, bloodshot eyes, sneezing. Sometimes they even have oral ulcers inside of their mouth. They can have these really ugly looking oral ulcers. We don't see that in cats that have been vaccinated very much, but if there's been no vaccines, they can have that. Some of the things that you can do at home, these cats do respond well to a humidifier. You're trying to humidify the area for them and kind of put it nearby them so that they can get some good humidity, help them to breathe a little easier. If your cat stops eating and stops drinking, that's when you really have to see your veterinarian. Occasionally the veterinarian will put them on antibiotics. Even though this is a virus and it's not going to kill the virus, it helps to prevent them from getting a secondary bacterial infection of their lungs, which might be a pneumonia case in your cat. So if they're not eating or drinking, you need to check with your veterinarian and get some antibiotics. And also sometimes we give them some fluids and even give them a vaccine while they're sick to try and boost their immunity.